Hello, and thanks for joining us. Welcome to the 2020 American Diabetes Association Living with Diabetes, Ask the Expert series. Today's topic is diabetes and eye health. My name is Carla Cox, registered dietitian and certified diabetes care and education specialist, and your host for today's program. Remember that our Ask the Expert series is all about answering questions from our listeners, so start getting your questions ready. For those of you on the phone, press star three on your keypad, and an operator will collect your question and place you in a queue so that you may have the opportunity to ask your questions live. To participate online, type in your name and question in the fields below the streaming player. Press the Submit Question button, and your question will come directly to us. Stay with us through the hour, and we will send you useful resources to help you live well on your journey with diabetes. In addition, we invite you to provide us with your feedback in our 5-question survey at the end of the event. Okay, now a little bit why we're here today. The American Diabetes Association, together with visionary partners, VSP Vision Care, and Regeneron Pharmaceuticals Incorporated, is focusing on an often overlooked but costly and devastating complication of diabetes, vision loss. This eye health initiative, Focus on Diabetes, provides tools and resources for people with diabetes to learn how to reduce their risk of developing eye disease by managing glucose values and getting an annual eye examination, even if symptoms are not present. As part of the initiative, the American Diabetes Association is holding this free educational question and answer. We'll cover information and tips to help you take charge of your health. The health and safety of all those we serve at the American Diabetes Association is always our top priority. The CDC has determined that COVID-19 is a serious public health threat. In general, people with diabetes face greater risks of complications when dealing with viral infections, and that is true with COVID-19. Currently, CDC recommends to protect your state that you wash your hands often. If soap and water are not readily available, use hand sanitizer that contains at least 60% alcohol. Avoid touching your face. Practice safe social distancing and put distance between yourself and other people if COVID is spreading in your community. Cover your mouth and nose with a mask or cloth face cover when around others. The ADA encourages people with diabetes to follow the guidance of the CDC and to contact your medical provider if you suspect that you are showing any symptoms or have been exposed to COVID-19. For our most up-to-date information, please visit our website at diabetes.org/coronavirus or call 1-800-DIABETES, which is 1-800-342-2383. And now I'm delighted to introduce our two guests for today's event, Dr. Blake Cooper and Dr. Jeffrey Gerson. Dr. Cooper received his residency and fellowship training in ophthalmology and vitreoretinal surgery at Washington University in St. Louis. Over the past 17 years, Dr. Cooper has worked in Kansas City caring for complications related to diabetes-related retinopathy. He has a personal and professional interest in improving the lives of individuals living with diabetes. He is the 2020 chapter board president of the JDRF, and his oldest daughter has been living well with type 1 diabetes for the past 8 years. Dr. Jeffrey Gerson graduated from Indiana University School of Optometry in 1997 and completed his residency concentrating in low vision and ocular disease. He sees primary care patients and has an emphasis on retinal care in his practice. Dr. Cooper, why don't you tell us a little more about yourself?
Well, thank you for allowing me to be here with you all today. I'm really excited about this program, and I have been practicing in Kansas City, as you mentioned, for the last 17 years. About half that time was spent caring for people living with diabetes that developed secondary complications related to their eyes, so problems that affect vision. And in treating patients with diabetes for the second half of that time, after my daughter was diagnosed with type 1 diabetes, I really have had a true appreciation for what it means by living with diabetes. I mean, fortunately, my daughter has had access to all the possible care that she could have, with continuing glucose monitor and insulin pump. But despite even having that technology and support, is a struggle to maintain glucose levels. And I think as a physician, we know how to oftentimes treat problems, but we don't always understand how hard it is to keep blood sugars in control. So I think I've had an interesting time in practice before and after that experience. But hopefully we'll be able to get into how we treat diabetes-related eye disease in a minute. So thank you for being here.
Thank you, Dr. Cooper. And Dr. Gerson, please share a bit more about yourself with our listeners.
Sure. Thank you, Carla. And I just would echo what Dr. Cooper said for thanking everyone for tuning in and for allowing me to be here. So kind of like Dr. Cooper, I've been practicing also in Kansas City for about 20 years. And really what kind of got me started on my journey related to diabetes, a little bit different than Dr. Cooper's, but I was at a meeting about 10 or 12 years ago, and one of my colleagues was there who had been living with type 1 diabetes for about 40 years. And I just kind of sat back and admired him and was really motivated by him. And when I got home from that meeting, really kind of started immersing myself into more education about diabetes and diabetes-related eye diseases. And as it turns out, that colleague who I was kind of inspired by and in awe of is now a very good friend, and we work on a lot of projects together still to this day. And so he's really kind of motivated me and got me so interested. And again, just really glad to be here and hopefully share some valuable information.
Thank you, Dr. Gerson. As we are waiting for our callers and online listeners to chime in, I'm going to go ahead and kick off with the first question. We all have heard that when you have diabetes, you have a greater risk of developing diseases of the eye that can lead to blindness. To start with, what is a very important tip you can give our listeners to identify if an eye complication is developing? Dr. Gerson, you want to take the first question?
Yeah, sure. So, I would actually give kind of probably a little bit different of an answer than what you would typically think of. Because instead of saying, well, look out for this complication or that complication, I think what I would say is to be on your front foot. And what I mean by that is make sure to have regular eye care, to have routine eye exams by a care provider that hopefully can uncover any problems very early on before you have any complications. Because so oftentimes people can have diabetes-related eye complications with no symptoms. And so waiting for symptoms oftentimes is waiting until it's too late. So something as simple as having your routine eye exam on an annual basis can be the best defense and the best way to find out if you're developing any complications.
Great. Thank you so much, Dr. Gerson. Okay, let's take our first question. Whoops. Angie, are you on the line? Angie Jackson from Woodland, Maryland?
Yes. Hi.
Hi. Could
Hello.
you give us your question, please?
I have been diabetic since 2002, type 2, and I suffer with high pressures in both eyes. Currently, it's at a 21. We've got it down to a 21 in both eyes. And I want to know, what should that mean to me? Or what could it mean?
Thank you.
So I can probably take that question for you. Thank you for sharing. Diabetes in and of itself typically tends not to lead to higher eye pressures. Now, it can in a very specific situation where having long-standing diabetes can allow blood vessels to form, and sometimes those blood vessels can form in the front of the eye that can raise your pressure. But typical pressure inside the eye should be around 16 plus or minus 4. So what I mean by that is somewhere between 12 and 20. When you start to get above 20, and 21 is still on the lower side, but that can then cause damage to the optic nerve. The optic nerve is sort of how the eye will talk to the brain. And that process is called glaucoma, and it's not uncommon over time for pressures to start to rise inside the eye. And that can be managed oftentimes, with eye drops and at the end, later stages, sometimes surgery. But having diabetes in and of itself probably would not cause you problem with your eye pressures. Now, it is important having that history to make sure you do have your eyes looked at least annually, and probably if they're following you for higher pressures, probably I would say at least every 6 months. But by controlling your blood sugars along with other risk factors, blood sugars are important, but also things like high blood pressure and cholesterol levels will help protect your eyes and overall health.
Thank you. Luella Grimes, are you from Portsmouth, Virginia? Or are you on the line? Luella?
Yes, I'm on the line. Can you hear me?
We can. So what is your question?
Okay, my question is regards to the condition of my eye. I have bleeding behind my eye, and I'm getting treatment, with a shot every month. But I want to know how can I get my sight back, and why did my blood vessels break? I forgot the name of the condition. It begins with an E.
Thank you. Dr. Gerson, do you want to answer that question?
Sure. I'll give it a shot, and then I think we'll get some additional comments from Dr. Cooper. So, when people have diabetes, when you talk about the back of your eye or the inside of your eye, what can develop is something called diabetic retinopathy. So the retina is kind of the inner lining of the back of the eye. And we've got lots and lots of tiny little blood vessels in this layer, in the retina. And so what tends to happen in diabetes is these tiny blood vessels can become leaky. And they can either become leaky, or sometimes we grow extra blood vessels that are actually not a good thing. And so the treatment that Luella was referring to is delivery of medication into the eye to try to get these either abnormal blood vessels to go away, or to get this leaking from the blood vessels to be able to stop. And so, unfortunately, this is a fairly common condition in people with diabetes. And Luella was asking about, how do I get my vision back? So the first step is knowing that you have a problem and getting to a specialist to initiate treatment, just like what she's doing. So that's absolutely the first step. Now, what's important to realize is generally these treatments are not just have it done once and done. And so it's a series of treatments over oftentimes not just months, but over years. And so it's a long-term process to try to regain as much vision as possible. And then after that, to try to maintain that vision through either eye treatments or, as Dr. Cooper mentioned earlier, the importance of just good glycemic control along with high blood pressure, cholesterol, and just healthy lifestyle habits. The one other thing that I would add in regarding the question of how do I regain my vision is that, unfortunately, for some people, even with the best treatments and best intentions with the medicines, some people's vision will still end up not as good as what they would want it to be. And so there are doctors that do what's called low vision, and that's where patients have vision that basically just isn't as good as what you want it to be to function, to do some of the things that you maybe used to be able to do. And these doctors will help you to find the right types of devices, whether it be magnifiers or sometimes kind of high-tech digital devices to help you to be able to read and do some of the other things that you want or need to be able to do. And so I guess just to real quickly summarize, diabetic retinopathy is fairly common and sometimes results in needing treatments to try to take care of it. And that even with treatment, some people will require help from what's called the low vision specialist to try to help them to be able to function a little better. But those treatments are actually what Dr. Cooper does every day. So I'd love to hear if he has any further comments on that.
Well, thank you, Jeff. No, I think you summarized it wonderfully. The everybody expects for treatment to make them better, which is understandable because why would you have something done if it's not going to help you improve? But it's also understanding that retinopathy tends to be a progressive condition. It tends to continue to get worse, and you hate to sort of really sort of think about it, but it can lead to loss of vision and ultimately complete blindness. And so not only is it important to maybe try to improve vision, but it's really important to try to reverse the stages and levels of retinopathy. And, up until about, I would say probably, 12 years ago, we only had laser treatments to be able to slow down and prevent visual loss. And now with those intravitreal injections and medicine that's put directly into the eye, we're able to actually help slow down, but also even reverse some of the stages of retinopathy. So while we may not get vision back, we can hopefully prevent things from continuing to progress. About the only other thing I would really sort of make sure that it's important to understand is that oftentimes by the time we reach that point of needing treatment, we're also having other systemic problems with diabetes-related nephropathy or affecting our kidneys, and also from a cardiovascular standpoint. And with newer medications available, we're able to also help with those conditions. So if you are having eye problems, it's important to make sure that your primary care physician or endocrinologist are helping manage your kidney problems and your heart problems in addition to the eyes. Thank you for your question.
Thank you. Thank you. If you are just joining us, welcome to today's Ask the Expert Question and Answer, Diabetes and Eye Health. As a reminder, for those of you on the phone, press *3 on your keypad, and an operator will collect your question and place you in a queue so that you may have the opportunity to ask your question live. To participate online, type in your name and question in the fields below the streaming player. Press the Submit Question button, and your question will come directly to us. So for the next question, and I think this is asked quite a bit, so I think it's a great question, and that is coming from Miriam Rodriguez. Are you on? Miriam from New York? Miriam, can you hear me? I'll just read her question. My A1C is 6.2 to 6.7. Can my eyes still be affected?
So I'll take that one, Jeff, if you don't mind.
Sure.
So the answer is yes. Your eyes can still be affected. An A1C of 6.2 to 6.7 is wonderful, and you really have to be sort of commended for that. Part of it is what your A1C is, but it's also how long you have diabetes for. And so if you've recently been diagnosed and your A1C is typically below 7, you are doing wonderful. Now, as we get older and we have more comorbidities, oftentimes we will have the A1C be a little bit higher just because there's increased risk with hypoglycemia or low blood sugars. If you try to have your blood sugars be too low, it can be harmful in many other ways. But an A1C of 6.2 to 6.7 is great. But if you're going to live with diabetes for the next 20 or 30 years, you could still have some problems like increased risk for cataract formation or problems with the tiny little blood vessels in the back of the eye that affect the retina or the health of the optic nerve. So it is important, even though you have a good A1C and maybe you don't have any visual problems, to still have an annual eye exam. Not only is it important for eye health related diabetes, but also other conditions are picked up, things like glaucoma, like we mentioned earlier. I mentioned cataract formation can be occurring, and so there's other reasons why it's important to see an eye care professional.
Blake, if I could just add one or two just quick points to that, and echo what you're saying about an A1C between 6.2 and 6.7 is really fantastic, and just knowing what A1C is and knowing the number is really great. But I agree that over time we really need to make sure we watch and make sure we're getting routine care. And part of the importance of the routine care is that not knowing doesn't mean healthy. So not knowing is not necessarily healthy, and that you may have problems with your eyes and not realize it, kind of as we mentioned before. The one other thing that I wanted to mention other than A1C is a term that's a bit newer and maybe not known by everybody, but time and range. So what percentage of the day is your blood sugar reading within a certain range? And so we would need a continuous glucose monitor that I think you mentioned earlier, Blake, to be able to tell what time and range is. But that's another way to be able to help predict or know risk for retinopathy. The better job you do of keeping it within a certain range, the better off you'll be long term.
You're absolutely right, Jeff. And for those of you who aren't familiar with that term, the range we're really looking for is you want your blood sugars between 70 and 180, about 70% of the day. If you can do that without having a lot of episodes below 70, you're going to be doing exceptionally well. You still need your eyes to be evaluated, but that is going to help your overall health.
That's great. And as an aside, for those of you that are unfamiliar with a continuous glucose monitor, it's available to almost everyone now, including on Medicare, if you're taking injections for your diabetes. So if you're taking insulin and you're checking your glucose frequently with a finger stick, you would be eligible. So it's something I would talk to your primary care about because it's an excellent way to see trends and patterns and where your glucose is going. All right. Nancy, are you on?
Yes.
Nancy? Okay, Nancy, you want to ask your question, please?
Yes, my question was just what is involved in a test for glaucoma by your ophthalmologist?
Sure. So I'll take this one. So testing for glaucoma is really part of any routine eye exam that you get by any eye care provider. And so there's a couple things that should be looked at. And so part of the equation is your eye pressure, which Dr. Cooper mentioned earlier. That's generally between about 12 and 20. But some people can have a high eye pressure and not have glaucoma, and some people can have a low eye pressure and still have glaucoma. So it's important that that's not the only test that's done. The other thing that Dr. Cooper mentioned was examination of your optic nerve. And so the way that I would describe, or the analogy for your optic nerve, is that your optic nerve is kind of like the telephone cord that connects your eyes to your brain. And that telephone cord, or that optic nerve, is what gets affected by glaucoma. So examining it by looking into the eye is a very, very important way to screen for glaucoma. And then lastly, sometimes if there's any suspicion of glaucoma, there's other tests that can be done. Probably one of the more common ones is testing your peripheral vision, because glaucoma tends to affect peripheral vision. So that would be an automated test. And then there's also an ultrasound-like machine that can check the health of your optic nerve. So the very basic ones are eye pressure and examination of your optic nerve as part of the exam, and then some more advanced instruments that can further test to detect glaucoma. And similar to diabetic retinopathy, finding glaucoma early is really important, because when found early and treated, most people do great and never have any loss of vision or any change to their overall functionality.
Great. Thank you. All right. Let's go to Tricia in Illinois. Tricia, are you on?
Yes, I am. Can you hear me?
Yes, we can.
And I know you didn't want to butcher the name of the town, but it's Pecatonica.
Yeah,
I'm newly diagnosed. No, it's old Indian burial ground kind of area, rural. I wanted to go back just for a second. I know you had said something about I'm very newly diagnosed as of literally 1 week. And you had just mentioned something that I'm trying to take notes, and I can't write very well because 8 years ago, I've always been hypoglycemic. 8 years ago, I was diagnosed with colorectal cancer at the age of 41, and I was diabetic during chemo, 2 rounds of chemo, but then they said no longer. And you had said something about a monitor, and Medicare covers it, and I didn't catch the name of what that was. I couldn't write fast enough.
Okay.
That's okay.
So it's a continuous glucose monitor, and you would need to talk to your primary care about it. Continuous glucose monitor.
I'm sorry, I can't write fast with my hands. I'm so sorry. Okay, monitor.
Continuous
Okay. Yep, I've
glucose
got it.
monitor. And then,
Perfect.
and then
Thank
you
you.
also had a question about blurry
Yes.
eyes. Is that right? Yes.
Yes,
Okay. So
correct.
let's see if we can answer that one as well. So she's newly diagnosed as having problems with blurry eyes and wonders what to do.
So I think, Tricia, I know it's a scary time for you, and I want you to take a deep breath and know that it's going to be okay. Typically, at the time of diagnosis, and Jeff can probably, Dr. Gerson can probably speak to this as well, it's not uncommon to have blurred vision, in part because blood sugars have been fluctuating, and as blood sugars fluctuate, go from a higher level to a lower level or a lower level to a higher level, that can cause changes inside the eye, particularly with changes of the focusing system of the eye, that causes our vision to be blurred. Now, typically, by having a more constant blood sugar level in that range like we talked about, will help stabilize your vision. And so typically we want to make sure that you are getting in to see your primary care physician or your endocrinologist, and that you're getting appropriate treatment, and then give it time to work, and then make sure that you get in to have your eyes evaluated once your blood sugars have stabilized. Now, if you have had diabetes for longer than a week, then oftentimes we worry that blurred vision can be associated with other problems, things like cataracts or difficulty with the retina, particularly either what we call macular edema or swelling in the retina, or macular ischemia, which is poor circulation to the retina. But please take a deep breath. Know that it's going to be okay. You are actually being diagnosed in a wonderful era. There are several newer classes of medications that are available to help treat diabetes, as well as increased technology that is making lives easier for those living with diabetes.
Thank you.
Yeah, I just want to echo a couple things that Dr. Cooper said. And, the first is that, Tricia, it's very common for us to see people with blurred vision or fluctuating vision that, as Dr. Cooper stated, as you get control of your blood sugar, it comes back and renormalizes. So one thing that I would say is don't jump to get a new pair of glasses or get glasses too quickly, because if you get glasses while your blood glucose readings are poorly controlled, once they're well controlled, then the glasses may not work very well. And the other thing that I would tell you, Tricia, and commend you on, is it's fantastic that with a new diagnosis to already be immersing yourself and being on a call like this, because there are studies that show that when people do a really good job of taking care of themselves right at the beginning, when they first have diabetes in the first few years, it helps them long term. That people that do well on the onset are still doing well 20, 25 years later, or better 25 years later, than those that didn't have good control at the very beginning. So, I commend you for being as an active a participant in your care as I can imagine that you are. And just know that the hard work that you do now will pay off for literally decades to come.
Thank you. Debbie from Maryville, Missouri, are you on?
I am. My question is, what exactly is macular edema? You just mentioned it. And why are people with diabetes at a higher risk? And I'd like to follow that up with an additional layer. Is a dilated eye exam the top-notch way to get your eyes examined, or are the newer techniques sufficient?
Those are tough questions.
They are.
They are, aren't they? So I would be interested, Dr. Gerson, to know your sort of take on the dilated eye exam portion. My bias is that it's not just looking at the retina that's important. There is so much more to an eye exam than a fundus photograph. Now, I think that as a screening tool, photographs or other modalities of imaging the retina are helpful, but I'd be interested to know, Dr. Gerson, about your take on a dilated exam.
Yeah, so what I would say is I think the important term here is comprehensive eye examination, which means not just, what's your vision, do you need glasses, not just do you have glaucoma or do you have changes from diabetes in your retina, but doing all of that. And really, a dilated eye exam is certainly one of, if not the best way to view the retina. What I would tell you is I think that the best way is a combination of both a dilated eye examination along with using technology, whether that technology be photography that gives a really, really wide field of view, or whether it's using an instrument called OCT. And so that's kind of a very fine-tuned ultrasound scan of the back of the eye. So someone may have very, very subtle macular edema that's hard to pick up in a regular exam, look at the doctor looking, but sometimes the technology can help with that. So I think a combination of both is really what's best. And, for what is macular edema, I think the best way to describe that on really kind of in layman's terms is it's just leakage of fluid, and unfortunately in a bad spot, because the macula is where we have our very fine central detailed vision. And so when you have leakage of fluid in the macula, that's what causes macular swelling. And when that part of the eye swells, it generally has a negative effect on our vision. That's maybe too simple of an explanation of what it is. Maybe Dr. Cooper can kind of tell us a slightly different version of how he would explain it.
Sure. And I do agree with you that the OCT imaging that we use really helps us define location and where that swelling or edema is and how significant it is. We'll oftentimes say that it's either central involved or non-central involved, so whether or not it's affecting the very center portion of the vision or sometimes the peripheral vision, because that helps guide different treatment modalities. But essentially, long-standing elevation in blood sugars weakens the small capillaries in the back of the eye that feed blood and oxygen to the layers of the retina. Really, by weight, the retina is probably the most metabolically active area in our body. It needs a tremendous amount of oxygen for the cells that we call photoreceptors to help sense and record light. And so because of that, we have a tremendous amount of blood flow going in and out of the eye. And elevation in blood sugars weakens the walls of those blood vessels. So as blood vessels weaken, they can sort of start to cause fluid to develop into the layers of the retina, and sort of like a sponge becoming swollen, the retina becomes swollen, and that ultimately starts to cause damage to some of the nerves of the health of the eye, and also shutting down blood flow and circulation to other parts of the eye. So macular edema or swelling is really due to not just one-time elevation in blood sugars, not due to a couple months of elevation, but really chronic elevation in blood sugar, in addition to oftentimes complicated by elevations in blood pressure and lipid or cholesterol levels. And so it's important to really sort of control all three ABCs, or your A1C or your elevation in blood sugars, control your blood pressure as well as your cholesterol to hopefully prevent the one of the complications related to diabetes in the eye, macular edema.
Thank you. We do have some questions online as well, and a repeat question is, should I be taking vitamins for eye health?
So it depends on why. Oh, sorry, go ahead.
No, go ahead.
I was going to say it really depends on why you are going to be taking those vitamins. If you have a condition that is in the moderate to advanced stages of what we call age-related macular degeneration, eye vitamins are going to be helpful at slowing down that progression. Typically, for other conditions, we do not recommend eye vitamins. And so if you're going to do anything to help the overall eye health, if you have diabetes, it's number one, making sure that you're having your eyes looked at on an annual basis. Number two, it's, again, controlling those ABCs, your blood sugar, your blood pressure, your cholesterol level. And this might sound like it makes sense, but you'd be surprised how often people tend not to do it. test your eyesight. And what I mean by that is every now and again, cover one eye and make sure you still can see out of the eye that's uncovered, and then reverse the process. Because we tend not to cover one eye or another, and we might lose vision and not notice it. And while that sounds simple and easy to do, it's oftentimes missed and overlooked.
Thank you. We do have a question. Gary, are you on? Gary is from Westfield, Massachusetts. Okay, what's your question?
Okay, I'm back history. I'm a type 1 diabetic, diagnosed over 30 plus years ago, 51 now, so late teens. Probably had it before that. But some years ago, about 10 or so, I was literally at work and I was going blind while on my job, and I did a lot of close work in manufacturing. And I went right away to my regular doctor who was not available, who was on vacation. I went to a different doctor, and he didn't tell me a lot, but he sent me right away the next day to a retinologist, which I just want to say I think saved my vision entirely, because I was diagnosed with PDR and literally was given several rounds of laser treatments, and then towards the end of it, they did a few injections, which sounds scarier than it is. It actually is no pain, so do it if you got to do it, my recommendation. But my question was, what are the chances of that recurring? Because I was told it can go into remission, and that if I ever see like anything like going blurry or anything, I do get eye exams every year, but if I ever see that blurry coming out like it did so fast, to react. But what is the chances of it coming back full blow?
Thank you.
So, Gary, thank you for sharing. Typically, once the eye stabilizes, assuming that your blood sugars stay in a good range, that time in range, or your A1C typically below 7, it is rare for it to continue to progress. We do see other things develop later in life, things along the lines of cataracts, and oftentimes after cataract surgery we can see progression of retinopathy. But it's been my experience in treating people for a long time who are in your situation that once we get them to be stable, you might need an occasional injection every now and again. Occasionally you might have another hemorrhage, but not to the level or severity of probably what it was when you were diagnosed, or with the proliferative diabetic retinopathy. For those not familiar with that term, it's where new blood vessels have grown in response to the old ones shutting down. And so I would encourage you to continue to do your best by controlling your blood sugars. If you're not on a CGM or an insulin pump having type 1 diabetes, the new sort of closed-loop systems that are available are really keeping people in range. And so I encourage you to do that and continue to have your eyes looked at, but you should hopefully continue to do well.
Thank you. We're going to go to Clarence from Atlanta. Are you on the line?
Yes, I am. Thank you for taking my call. I am a senior citizen. I'm 72 years old. I've had diabetes for, I think it's 12 to 15 years. It's type 2 diabetes. However, I've had problems in my history. Well, both my father and his older sister, had cataracts. They had glaucoma, and they both had corneal transplants. What my concern is, do I need to wear sunglasses? I normally wear them only when my eyes are being pestered by the sun. That means early in the morning, late in the evening, or at night when I'm getting a lot of bright lights in my eyes. Otherwise, they kind of get on my nerves, and I don't bother with them. Should I be more concerned about that? And what else might I need to be concerned with on that?
Thank you.
Yeah. Thank you, Clarence. That's a good question. So, as far as the sunglasses are never a bad idea for anybody because of how they help protect whether you have diabetes or not. Sunglasses are important for protecting our eyes from the UV light and even from something that we hear more about now, blue light. So wearing sunglasses, if you're able and it doesn't pester you too much, as you mentioned, is really a good idea. But you ask about what other things you can do. And Dr. Cooper kind of alluded to this in the question earlier about vitamins. And I think that something that's really important for anybody is really paying attention to the foods that you eat. And so if you have diabetes, we're probably doing this already because we're trying to control our blood glucose levels. But there's certain foods that are better for our eyes. So in particular, green leafy vegetables like spinach and kale are really good for our eyes and may potentially be helpful. But, one of the things that I always talk to my patients about is that the things that are good for your eyes are no different than the things that are good for you in general. So having good blood glucose and blood pressure and cholesterol control, trying to have an active lifestyle where you're getting some sort of exercise, whether it's going for walks or if you go to swim or whatever it is that you enjoy, can be really helpful and beneficial. And then, one other thing that I think is really important that sometimes we don't think about is smoking. That, we know that smoking can cause lung cancer and isn't good for us in general, but smoking is bad for our eyes in general, not even just specifically when we're talking about diabetes. So all these things that are good for you are ultimately good for your eyes.
I think those are all excellent sort of points. The only other thing I would sort of add to that is with your family history, if and when you get ready to have cataract surgery, you probably want to see a cornea specialist to make sure that your endothelial cells, or the cells on the back surface of the cornea, are going to be healthy enough to have cataract surgery. And really, you probably should see a cornea specialist. But that's specifically for you and not necessarily related to your diabetes, but just because of your family history.
Thank you. We have another online question that's very interesting at this point in time, and that is, as we work remotely in front of our computers during this time, are persons with diabetes at greater risk for eye problems, and what techniques are recommended to maintain good eye health while online?
Well, I will say, first and foremost, occasionally get up and walk away from your computer. Go for a walk, take a break, give your eyes a rest, but also get up and move. That's the one thing that we don't always sort of incorporate enough time in our day for is exercise. And exercise doesn't have to necessarily mean getting your heart rate up. It could be going for a walk and taking a 10 or 15-minute break. I think that's extremely important, not only for our eyes strain, as you were, I think, trying to allude to by using the eyes at a computer, but just the mental aspect of trying to clear your mind and have just a few minutes where you're not tied to the computer. And that's easy to say as we're all sitting at a computer, but difficult to oftentimes incorporate.
Thank you. Lillian, are you online? Lillian from New York?
Yes, I'm still here.
Okay, could you give us your question, please?
Well, I was wanting to ask a question about cataracts and what would be a good time to have them removed if you don't really have an eye problem of vision, but you've had laser surgery in the past.
Thank you.
Sure. So, Lillian, thank you for asking about that. And, this conversation about cataracts is something that, for me, comes up in practice literally every day. And the way that I describe, or the way that I have this conversation with my patients every day is it's time to consider cataract surgery when your vision is starting to bother you and you're not doing all the things you want to be able to do because of the cataracts. Now, if you've had previous laser, and I don't know exactly what the laser was for, but sometimes it's laser from something diabetes related that may be affecting your vision as well. So it would be up to your doctor to help you determine if you're having issues with your vision because of cataracts or if it's because of something else. And if there's really any chance that they feel that it's due to cataracts, then generally there aren't too many good reasons to postpone cataract surgery. For most people that undergo cataract surgery, it's an easy procedure to have done with really, really good results. Now, that being said, people with diabetes have a little bit higher risk after cataract surgery to have some swelling in the macula, a little different than what we were talking about before, but same kind of thing. So there may be some extra precautionary measures that your surgeon takes, but in general, most people do quite well with cataract surgery. And to me, the biggest question that people ask about cataract surgery afterwards is, why did I wait so long?
I'm going to have a follow-up question for Dr. Gerson regarding the cataract. What do you recommend to your patients when they talk about the implant that goes into the eye when we have diabetes, and will I still need to wear glasses?
Yeah, so that's another one that really comes up every day. And I think what Dr. Cooper is alluding to is there's a couple different types of implants that can be put into the eye when you have cataract surgery. And so one of them in particular is what's called a multifocal implant. So something that potentially gives you both good distance and up-close vision and really decrease your independence on glasses. So that's something that's relatively new compared to historically. People would get lenses put in that just have one focus distance and generally just have both eyes distance focus. So you see great for driving or watching TV, but then you put on glasses for reading. So when it comes to people with diabetes, there's some concern oftentimes with the multifocal implants because the way they work, they're very dependent on something called contrast, which can be affected in diabetes. And if there's any even subtle changes to the macula, it can really throw a person's vision off, much more so than the more traditional lenses. So even though it may sound like a great idea to put these multifocal implants in, if there's really much or any diabetic retinopathy, if there's any changes to the macula, then these more specialized lens implants probably are not a great idea.
Very well said. Thank you.
Thank you. Vicki, are you on? Vicki is from Elko, Wisconsin.
Yes, I am.
Great. What is your question?
Well, simply, I've been T2 diabetic for about 8 years now, because it was caused by chemo drugs I was on before because I had chronic myeloid leukemia. And they kind of did a number on my pancreas. This was before they knew that particular drug had the potential to do this. Anyway, I was doing okay with my diabetes control and everything, but I was going to the wrong eye doctor, and I didn't realize it. I was doing the Walmart thing, and I finally found out that my insurance would cover going to an eye clinic and having the full diagnostics. And last winter I was diagnosed with diabetic retinopathy, mild to moderate, one eye different than the other. And of course, that was a little freaky, but anyway, I had to go back a couple months later because I was having a real problem with dry eye. And at that time, I was seen by a different doctor, and she said that she could find no sign of the diabetic retinopathy. So my two questions are, first, is that common for it to just kind of go away on its own? And the second one, is it common for diabetics to develop the dry eye, the chronic dry eye?
Thank you for your question.
Yeah, thank you, Vicki, for those questions. Let me answer the question: is it common for it to go away on its own? And the answer to that simply is no, it's not common. But oftentimes subtle or very mild retinopathy can oftentimes be very difficult to diagnose just by sort of an exam. Oftentimes they have to do additional testing, one of which is called a fluorescein angiogram. That's where oftentimes we'll inject some dye through the veins and watch that circulate through the eye. And it's a lot easier to see very subtle early changes, develop what we call microaneurysms, or areas of early abnormal blood vessels that might leak some of that dye into the layers of the retina. And that's a very easy way to sort of help sort of determine the level of retinopathy. But that being said, while it's not common, it is possible for stages and levels of retinopathy to start to reverse over time, and that we will see oftentimes with treatment that we do. So we have medicine that we were talking about earlier. It inhibits a molecule called vascular endothelial growth factor, and there's 3 different medicines that can help reverse the stages and layers of retinopathy. But we can also sometimes see that happen on its own with better control of our blood sugars. We will oftentimes see the levels of retinopathy either stabilize or start to reverse, but the typical trend is for retinopathy to over time get worse. And the hard part about that is that it's not until the very later stages of the disease that we become symptomatic. And so by symptomatic, I mean we have symptoms of blurred vision or floaters or just not able to focus like we once did. And so it's important to make sure that you have an eye care professional that you trust and that they're doing exams. Now, early on in the disease, they might not have seen any retinopathy because there wasn't any, and it took you 8 years before you started to develop changes that we were then able to diagnose without any specialized treatment. As far as the question you had about dry eyes, I would say the answer to that question is yes. Again, a lot of times when we have diabetes, and this goes not just for our eyes but the rest of our body, it can affect the nerves. And the surface of our eye is a layer called the cornea that has nerve endings in them that get affected when we have diabetes. So we don't always tend to feel things like in our feet, which is why it's important to have your feet looked at and examined so you don't develop an ulcer. But oftentimes you can get these nerves on the cornea to make it so that you don't feel as well, and oftentimes the eyes will be more dry with those symptoms.
Thank you. Jim from Vancouver, are you on?
Yes.
What is your question, please?
About a month ago, I was scheduled for an eye exam, but because of the COVID-19, the eye clinic was closed. I am now scheduled to get my eyes examined next week, and I've been having a lot of problems trying to see things close up, and wondered if there's any questions I should ask the ophthalmologist regarding my eyes.
You know, Jim, that's a really common issue that a lot of people have had, trying to be proactive with their care, but because of COVID-19 not being able to get in for their routine appointments, which are just so important in order to find anything early. You know, as far as questions that you should be asking, you know, before I even touch on that, what I would tell you is having some blurry vision up close is a very, very common symptom for anybody, whether you have diabetes or not. And, you know, usually when we get to be somewhere around 40 or 45 is when we start wearing bifocals to help with our up-close vision, although sometimes it's earlier in people with diabetes. And then as we continue to age, the strength that we need for the bifocal tends to go up a little bit. So it's, again, not uncommon for our near vision to seem to decrease a little bit over time. And so I think as part of your routine eye exam that you receive, I think it's important to ask questions like, do I have any signs of diabetic retinopathy? Do I have any signs of cataract? Dr. Cooper was just talking about dry eyes, and that's another important condition to ask about. And then also another thing that was brought up earlier was eye pressure, just making sure that's normal. And so if you're getting a comprehensive eye examination, a routine comprehensive eye examination, all these things should be examined. And then another thing that I think is real important to ask of your eye care provider is to make sure that they send a letter to communicate with your primary care physician or endocrinologist so that everybody on your care team is informed and knows how you're doing.
Thank you. We're about to take the last question. If your question has not been answered, please call our Center for Information at 1-800-DIABETES. Also, a reminder to stay online for a brief survey of 5 questions at the end of this session. So we do have time for one more question. Stephen from Missouri, are you on?
Yes, it's Avaz, Missouri. And I was just wondering, when I book an appointment with my eye doctor, how much time should I allocate for that appointment?
So if it's a first exam and it's not a routine follow-up exam, you're going to have your eyes dilated, and that typically can take anywhere from 20 to 30 minutes. But typically the workup, the exam, and then the sort of checkout process should take around 1 to 2 hours. Now, if you're seeing a specialist and you need to have treatment, it might be longer than that, but I would plan for at least 2 hours, and you'll probably, if you haven't had your eyes dilated, want to make sure that you have somebody with you to drive you home.
That's really important, I have to say. So this wraps up our last question for the session. A few items before we close for today. Consider staying online or on the phone to complete a short 5-question survey. We want to hear from all of you and hope you will take a few minutes to provide us with your feedback. To help you feel confident about your ability to prevent and treat diabetes-related eye disease, we encourage that you and your loved ones talk to your healthcare provider about your risk, schedule an annual dilated eye exam whether you have symptoms or not, and register for the next event at diabetes.org/experts. All of these links are on the Ask the Expert registration webpage. Once again, diabetes.org/experts. If you have questions about this event, you are welcome to contact us at askaba@diabetes.org or by calling 1-800-342-2383. Thriving with diabetes takes a village, and we're here to support you. Special thanks to our experts, Dr. Cooper and Dr. Gerson. I am Carla Cox, and on behalf of the ADA team, we want to thank you for joining us today, and we look forward to connecting with you at our next Ask the Expert event. Make the most of your healthcare visits on July 14th at 2 p.m. Eastern Time. I'll turn it over to the survey portion to close out our program. Best wishes for good health, and thank you once again for being with us.
All right, thank you again for joining us today, and we appreciate your feedback on today's event. To provide your responses, press the corresponding number on the keypad of your phone. And for participants online, please click on the poll section below the Ask a Question form and click to submit your responses. Okay, here's the first question. Overall, how satisfied were you with today's event, Diabetes and Eye Health? Use a scale from 1 to 5, with 1 being not at all satisfied and 5 being very satisfied. I'll repeat that again for you. Overall, how satisfied were you with today's event, Diabetes and Eye Health? Use a scale from 1 to 5, with 1 being not at all satisfied and 5 being very satisfied. And while we wait for the next question to come up, I would like to let you know that if you missed a part of today's event or you'd like to listen to it again, we have full recordings available by phone. You can call the toll-free number 866-686-8240 to hear the latest recording. Again, that number is 866-686-8240. Okay, ready for the next question. How frequently should a person with diabetes get a dilated eye exam? Press 1 for every 6 months. Press 2 for every 1 to 2 years. Press 3 for every 5 years. Press 4 for only when vision is affected. or press 5 for don't know. And I'll repeat that again. How frequently should a person with diabetes get a dilated eye exam? Press 1 for every 6 months, press 2 for every 1 to 2 years, press 3 for every 5 years, press 4 for only when vision is affected, or press 5 for don't know. Before we go on to question number 3, remember that our Ask the Expert Q&A, our next event, will be on July 14th at 2 p.m. Eastern Time. Our guest expert will give you tips for how to prepare for visits with your diabetes care team. To register for that event, go to diabetes.org/expert or contact our call center at 1-800-DIABETES, 1-800-342-2383. All right, on to question number 3. True or false? Diabetes-related eye diseases can have no visual signs or symptoms. Press 1 for true, press 2 for false, or press 3 for don't know. And I'll repeat that again for you. True or false? Diabetes-related eye diseases can have no visual signs or symptoms. Press 1 for true, press 2 for false, or press 3 for don't know. And while we wait for question 4 to load, I'd like to let you know that you can find resources related to this event on our website, diabetes.org/expert. Click on the June 23rd, 2020 event page under past recordings to find links to your eye health resources, as well as the full recording of this event. All right, moving on to question number 4. As a result of the event, to what extent do you feel confident that you can reduce your risk for diabetes-related eye disease? Press 1 for not likely, press 2 for somewhat likely, or press 3 for very likely. And I'll repeat that again for you. As a result of this event, to what extent do you feel confident that you can reduce your risk for diabetes-related eye disease? Press 1 for not likely, press 2 for somewhat likely, press 3 for very likely. All right, and we have one more question. While we wait for that one to come up, I'd like to mention that for additional information on managing your diabetes, you can enroll in an ADA-recognized diabetes self-management education program. This program will help you gain the knowledge, skills, and confidence to thrive with diabetes. You can find a link to a program near you on our website, diabetes.org/expert, or you can ask a member of our call center at 1-800-DIABETES. Okay, here's our final question. As a result of this event, how likely are you to have a regularly scheduled eye exam in which your pupils are dilated? Press 1 for not likely, press 2 for somewhat likely, press 3 for very likely. And I'll repeat that one more time. As a result of this event, how likely are you to have a regularly scheduled eye exam in which your pupils are dilated? Press 1 for not likely, press 2 for somewhat likely, or press 3 for very likely. Okay, thank you for staying with us and providing your feedback on today's event. We offer many thanks to today's experts, Dr. Cooper and Dr. Gerson, as well as the support vendors and visionary partners in the Focus on Diabetes initiative. This concludes today's program in the Ask the Expert series. You have your email address on file, expect to receive an email with resources from today's event, or you can also find the resources on our website, diabetes.org/expert. Thank you for joining us and stay well.